Mr. President, thank you very much. We are debating, discussing, and hopefully concluding our work on something called an omnibus appropriation bill. I certainly decry the method by which the committee, the Senate, and the Congress work in regard to appropriation bills. I'm a member of that Appropriations Committee, but there is no reason, none, that we could not do as we are supposed to do, as we are intending to do, 12 separate appropriation bills, one at a time, opportunity for the committees to have hearings with witnesses, to debate and discuss the content of that appropriation bill, pass it out of the committee, send it to the Senate, and let other members of the Senate who are not on the Appropriations Committee amend and discuss and debate that section of what today, tonight, this week becomes this large, all-encompassing bill. We all would be better off if we broke this down into the 12 separate parts that are now combined into this one large bill. We would know much more about it, and the deliberations would be more forthright, and we would have less likelihood of something being contained in the bill that there was objection to it being there. So I hope in the new Senate, the new Congress beginning in January, we as appropriators, we as members of the Senate, work hard to go back to the way things were before I was ever in the Senate, in which there is a budget, 12 appropriation bills then fill in the spaces on that budget, and then ultimately every member of the United States Senate has input into the outcome. I want to highlight something that's in the appropriation bill that we are discussing and considering at this point in time. Before I do that, I want to again indicate that one of the most important components to me in this legislation is the opportunity for us to more fully fund those who serve in our military and better care for our veterans who have served. There is some suggestion that we are rushing to complete this legislation before the new year. The reality is we are, again, because of the process that we have failed to follow, we're behind in the system. It's not that we are advancing a bill that was something to take advantage of in the future. We're 3 months behind in passing an appropriation bill that was due at the end of the fiscal year, September 30, 3 months ago. And if we wait to pass an appropriation bill into the new year, we're supposed to have our appropriations process completed in March. We'll just be beginning the discussion, debate about the old bill, the bill for this year, at the time in which we're supposed to be advancing the conversation, debate, and outcome of a bill to fund the new year. And in the process of doing so, we will have left our military at flatline funding. And the challenges we face in this country are so significant that no additional dollars to the Department of Defense for even a short period of time, months, 6 weeks, 3 months, a year, that's very damaging, particularly in these days of significant defense inflation. And so it is important for us to complete our work at a timely fashion. And unfortunately for us, that timely fashion is already 3 months ago. In this bill, in a bipartisan fashion, we were successful in adding a number of provisions to the bill that advance the cause of those who served our nation. So my point, first of all, is for those men and women who serve in our military today, they deserve something different than old funding or no funding or continued funding at a flatline level. And for our military men and women who served in the past, our veterans, they deserve many of the provisions that are now included in the appropriations package. Our military, as we know, is comprised of many selfless Americans who signed up, volunteered to serve. It is through their sacrifices, their family sacrifices, that they have protected and preserved the gift of freedom that we have in this country and what we should always cherish. In asking brave people to serve, men and women, generally young, we make as a nation a promise to them and to their families that their government will assist them in successfully returning to civilian life after their service. Specifically, I think we promise those who serve help for them in transitioning to civilian life through education, training, and economic assistance, to provide them medical care for their injuries or diseases incurred during their service, and to compensate them financially if those injuries prevent them from meeting their full earnings potential. As we consider the FY 2023 appropriation package, there are a few specific veteran bills that have been included in this legislation to give the Department of Veterans Affairs the tools and resources they need to meet the changing needs of America's veterans. The Joseph Maxwell Cleland and the Robert J. Dole Memorial Veteran Benefit Healthcare Improvement Act, long last name honoring two previous members of the United States Senate, including my successor in the seat I hold in the United States Senate, Senator Bob Dole. He himself, not only a Kansan, but a significantly wounded veteran, and an individual who never stopped fighting for his fellow veterans. It is an honor to name this legislation with his respect in mind. This legislation, described in that title, this legislation delivers new benefits and improved resources for the VA, including a specific bill that I introduced, one that's we call in short words GAPS, guaranteeing health care access to personnel who served. That act builds upon previous legislation and efforts to continue to lay a groundwork necessary to transform the VA into a modernized, innovative healthcare system. It includes protections to safeguard veterans' access to care from highly qualified providers in VA medical facilities and through the VA's community care network to help veterans across the country, including those in rural, a significant component of my state and yours, and remote communities, that those veterans get the care they need when they need it and where they want it. It would also require the VA to establish a pilot program to empower veterans by letting them schedule their own appointments, just like they would be able to do if they were seeking care elsewhere. Additionally, this package includes another piece of legislation, the Strong, S-T-R-O-N-G, the Strong Veterans Act, a set of mental health legislation, including the Reach for Veterans Act. This legislation would require the VA to make key improvements to the Veterans Crisis Line and to conduct outreach on the rollout of 988 as the new suicide and crisis hotline. Additionally, the Strong Act includes my 9/11 Veterans Mental Health Care Improvement Act, which would require the VA to expand access to mental health care, increase its mental health workforce, and direct the department to conduct critical research on brain health. Lastly, this mental health package includes a bill to improve mental health and suicide prevention outreach to American Indians and Alaska Native veterans. We must make certain that our country is doing all it can do to honor its promise to care for those who have borne the battle and for their survivors. I urge the passage of the provisions in this bill that are so important to veterans. It's included in the entire omnibus spending package. Mr. President, I know that you've dedicated attention to the veterans that you know and care about. I look forward to working with you and my colleagues as we continue this effort to make certain that those who served our country receive what they were entitled to. Mr. President, this bill is in its entirety, beyond just these provisions related to veterans, is a way that we can help those who serve our nation today and honor, respect, and provide for those who served our nation in the past. Mr. President, I yield the floor.